I'm Dr. Judith Trudell. I'm a member of the History of the Society Committee, and this morning, on behalf of the committee and the Society, I have the pleasure to interview Dr. Ian Lavery from the Cleveland Clinic. Dr. Lavery, what got you interested in colorectal surgery?
That's a long time ago, but I think it started during my residency in Australia. I'm very fortunate to have had great mentors who were also interested in the subject, and when you have someone who's got an interest and can stimulate you, particularly at a younger age, you tend to adapt. And luckily the mentors taught me well. They had good connections. Initially in the United Kingdom, I went to London, did further training, and then subsequently again through contacts and from my original and from England, that allowed me to have the privilege of coming to work with Dr. Turnbull. And someone with his reputation, his expertise, and such a charming man, how could you not be usurped into continuing that interest? And it's just gone on. I've seen a lot of changes over the last so many years, and they're all interesting. Some of the changes have remained, others have been replaced by more modern, different technology, new drugs, better equipment, and my interest in the specialty continues.
Who were those mentors that got you started on the path?
Well, in Australia, it was Dr. Neville Davis. He's no longer living, but Dr. Davis was interested in two things: melanoma, malignant melanoma, and he became a world authority on melanoma because the particular part of Australia that I grew up in has the highest incidence of melanoma, skin melanoma, anywhere in the world. And he brought that to the forefront. He was friendly with Dr. Rupert Turnbull, and Dr. Turnbull had visited Australia several times, and he'd been to the Cleveland Clinic at that time. And I went to London, where I had a great opportunity to work in one of the community hospitals, Chase Farm Hospital, which is on the northern end of the Piccadilly line in London, and had a wonderful opportunity to go down to St. Mark's Hospital, where I worked one day a week with Mr. Peter Hawley, and that was for a year when I was planned to come to the Cleveland Clinic to work with Dr. Turnbull. So all of those experiences were very, very positive and enabled me to continue my career and stimulate my interest.
How did you get involved with the society?
Well, it's difficult to be in a place like the Cleveland Clinic and not be involved in a society like this. But my mentors, again, Dr. Turnbull, Dr. Frank Weekly, and the people that I was with at the clinic at that time, all were members of the society, and naturally reading the journals, and we had to become a member of the society. And at that time, the society was not nearly as large as it is now, and everybody knew everybody else, and you got involved in committees, presenting papers, and ultimately being asked to make presentations, give lectures. And it's one of those things that just, it wasn't a conscious decision to be part of it. It was just natural that was assumed that you would.
Right, it was
and
organic.
That's what happened. Yeah.
What would you say is your greatest contribution to the society?
Well, nothing momentous, but no, I've been involved in a lot of the committees, participated in decision making, trying to influence the education process, because that's, I think, a large part of what the society does, is educate our members, keep up to date, and I like to think that I've been part of that, made some contributions there.
You certainly have educated a large number of fellows and residents through your years at the Cleveland Clinic.
Right, and that, I think that leads to being involved in the society.
Mm-hmm. You've mentioned several times there's been a lot of changes. So what do you think are the biggest challenges that we are facing right now?
Well, I think there's always challenges. There's always change. That's inevitable. If we're going to make progress, there have to be changes. At the present time, I think there are two concerns that I would have. One is our ability to train our fellows adequately with a one-year program. The advances both in technology and drugs and our options to treat multiple conditions is getting bigger and bigger, and to absorb all of that knowledge in a 12-month period, I think it's a big task, and I think some of the fellows now, well, I know they're not as well versed in much of what we do as I would like to see them when they go out. The other challenge I think we have is, and again, it's without trying to sound too harsh, the injection of technology into the practice. Mm-hmm. I think technology that's maybe not as good as it might be set forth. People get involved in the technology but don't understand the disease process or the anatomy or the potential complications that go with it. And I think that's a challenge that the society and probably the board will need to address at some time in the not too distant future, to make sure that the standard that's been set over the years is maintained.
Would you have any words of wisdom or advice to give to young colorectal surgeons who are just starting in practice?
First of all, know the basics. Very, very important to know the basics, and to keep interested, be involved in the societies, and expand your knowledge as it goes. That's being part of the society. You'll keep up with what's going on. I guess I've been around long enough to see ideas come and go, both in treatment, the improvements in medications, the improvements in technology, the number of operations for different things that have been proposed that have had their day in the sunlight, but then they've gone away and probably never to be heard of again. So don't become stuck in your ways. You've got to be prepared to change, but don't forget that all change is not for the better. Okay. And as long as you've got the interest of your patients and your colleagues, referring doctors, everything will work out well.
Thank you very much, Dr. Lavery.
Thank you very much.